I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. Thanks very much for joining us. My next guest, Dr. Mark Bayless, pediatric dentist. Dr. Bayless, thanks very much for coming on the program.
Thanks for having me.
Dr. Bayless, I've known you for some time, and I saw this very impressive article in the Herald about a month ago about you doing international dentistry work. I think that's great, and I wanted you to come on the program and tell us all about it, in addition to telling us about pediatric dentistry. You know, I'm going to learn a lot because I thought that, you know, children didn't need any dental attention until they had their adult teeth, or maybe after that. So I think you're going to teach us all about that. So first of all, let's start by talking about telling us what a pediatric dentist is and what does a pediatric dentist do?
Okay. Just as a pediatrician takes care of children on the medical side, pediatric dentist does the same thing for the pediatric population. We, after dental school, we do a residency and in a hospital or in a dental school where we learn various things that are very different than what a general dentist does with growth and development and the eruption pattern of the teeth. And the teeth are different. The primary teeth are different than the permanent teeth, and they come in at various times, and they have a lot of different situations that general dentistry doesn't have. So very often, a general dentist can look in a child's mouth and not really know what's going on in there because there's some teeth leaving and other ones coming in. It's a very different situation. And in addition, we're also taught a lot of behavioral techniques, how to deal with kids, because kids aren't always as cooperative as adults are.
No, I understand. So Dr. Bayless, let's go over this. So anybody who wants to be a pediatric dentist, of course, you finish high school and you finish the 4 years of college. You get a college degree.
Right.
And then you go to 4 years of dental school, is it?
4 years of dental school, just like 4 years of med school, and then you go on and do a residency to become a specialist. So if you are a general dentist, at the completion of a dental school, you can go out and start practicing. To be a specialist like an oral surgeon or an endodontist, which does root canals, or a periodontist who does gum surgery, or an orthodontist, or a pediatric dentist, we have to complete a residency in additional training in order to become a specialist in that specialty.
I see. Well, Dr. Bayless, tell me a little bit about your own training and where you're from and where you studied, and and your additional training after dental school.
I grew up in Southern California in Anaheim. I went to UCLA undergrad.
You see, another UCLA. Where are these?
Did you go there too?
No, I was chief resident at USC, Dr. Bayless.
Okay.
And had I known that,
sorry to hear that.
I may have, you're right. You know, I may have changed my mind about inviting you, but of course I'm just kidding.
Oh, you gotta love the Bruins. You have a Bruin tie on, by the way.
Well, so anyway, back to UCLA and USC. So you trained?
I went to UCLA undergrad, and then dental school, I went to University of Pennsylvania in Philadelphia. And then after that, I went to University of Connecticut to do my residency training there. And at the completion of that, I wanted to come back to California, and I came back here to Monterey, and I've been here since 1984.
Great. So Dr. Bayless, tell us about your average week as a pediatric dentist, the types of issues you see in the office, and how you take care of children, and the type of problems that you take care of.
Well, a good example is I got a call from a friend of mine yesterday whose son slipped and fell and broke his front tooth off. And not all the way, but a big fracture in that. And he called me this weekend, and so he came in today for us to do some bonding on that tooth, where we built it back up into its full shape, and can't tell at all that he ever chipped it at all. So that's one thing we do, emergencies. Sometimes people or kids will fracture their teeth, or they'll even avulse them, which means they get knocked out completely. And when they get knocked out completely, you can also re-implant those teeth and splint them, and you can save those teeth there. And one word to parents and coaches and everybody out there, if your child ever does get a permanent tooth knocked out, put it in milk or a salt solution, or even back into the kid's socket where it came out of after washing it off gently. And that's the best way to preserve the tooth, because if you put it back in a timely fashion and you preserved it right, you can save that tooth for the rest of their lives.
Now, see, that's worth the price of admission alone right there in terms of public health, that our viewers and listeners should know that teeth can be saved.
They can be saved.
If they're knocked out.
And that's a permanent tooth I'm talking about.
Okay.
Pretty much if a baby tooth gets knocked out, you pretty much just leave it out. But a permanent tooth you can put back in and you can save it.
Now, Dr. Bayless, you know, I'm going to learn a lot in the 15 minutes we have left, I'm sure. Now teach me about what we call baby teeth, and then there's adult teeth.
Okay.
Right? Now,
Yes.
do you call baby teeth deciduous teeth?
We call them deciduous teeth or primary teeth.
Okay. And
Okay.
then there's the permanent teeth.
And then there's the permanent teeth.
Now, about at what age is it supposed to switch over?
Well, it comes in, the first teeth come in between 6 months and a year, and that will be the lower anterior teeth, the lower front teeth.
Okay.
So they come in over time. You will end up with 20 baby teeth, but the first ones come in, the earliest, around 6 months or so, and then they start coming in as you go toward the back of the mouth, with the last baby molar coming in around 2.5 to 3.5. So it's very important, as soon as the first tooth comes in, to start cleaning that tooth. As a matter of fact, the American Academy of Pediatric Dentistry recommends the first visit to be around age 1. And that is so that we can teach parents at a very early age how to take care of their children's teeth, which involves simply just giving them a little cleaning, either with gauze or a little toothbrush, just so they get used to your hands being in their mouth. Just like you're always wiping their bottom since they were little, and they're used to that, and you're used to putting the kids in a situation where you have to clean something. And so it just takes a couple seconds to clean the first tooth. And then as you have more teeth, it takes a little bit longer and a little bit longer. They're used to it, and then it's hopefully will never be a big battle. And if you can keep the plaque off the teeth, you don't get decay. It's really simple, because foods do not cause cavities. It's the bacteria that are in the teeth, which we call plaque, that eats the food that we eat, and they make acid. But it only eats one type of food, and that's carbohydrates. So when you're eating on nuts and fruits and meats and cheeses and veggies, you don't get any acid production whatsoever. But when you're eating a lot of goldfish and crackers and pretzels and a lot of carb stuff, the bacteria eat those things for hours and make acid for hours, then you get decay.
I see. Okay, now at roughly what age do the adult teeth come in?
And then the first adult tooth will come in. So you'll end up with 20 baby teeth.
Okay.
And the 20 baby teeth, they start coming out in the same order that they came in. So the front teeth will be the first ones that come in, and that's around 6.
Okay.
Some kids are 5, some kids are 7, or even 8, and so they start being replaced right down here again. And so they start coming in, and they replace all the teeth, and the last baby tooth to come out, which is that second primary molar, which was the last one to come in, that usually comes out around 10 to 13, sometimes 14 even. So they're there for quite a long time. So it's very important to fix these teeth if they have problems with them, because they're going to have them for a long time. We need our teeth for our self-esteem. We need them for eating. And anytime you have pain in your teeth, you don't thrive as well. And that's one of the reasons we go overseas to help these kids over there, because they have so much pain in their teeth and they can't grow and thrive because they never get seen by a dentist.
You see, Dr. Bayless, another great segue. So as many of the people in our audience know, listeners and viewers, I do a lot of cleft lips and palates in children, and I go overseas and fix up kids. I'm going to go to Colombia in a few weeks.
Right.
And I admire your work. And I read this article, as I said, about a month ago in the Herald, about you going to a Latin American country and donating your services for children. Is that right?
That is correct.
Okay, so tell us about that program. What's the name of the program, and where do you go, and
Okay.
how often do you go?
Our group is called International Health Emissaries, and we are basically a group of dentists and volunteers from the Monterey Peninsula here, and we have people from Southern California, some from the East Coast, some from Oregon, but basically we volunteer our time to go to developing countries, places where they don't have access to dental care. We don't work in the big cities. We're usually in rural areas where there are not any dentists. I mean, basically in our society, in developed countries, developed nations, there's about one dentist for every 1,600 people. And in a place like Cambodia, for instance, where we go to work, there's one dentist for every 119,000 people. And then when there are dentists, the dentists are usually located in the major capitals or the major urban areas, and they're not located in the countryside. And so dentists aren't there anyway, and even if there was a dentist, they don't have enough money to be able to afford to have treatment done. So we go to places like that where they have no access and no money, and we provide dental care free of charge to the patients that come in and see us.
Now, I want to give the name of your organization out again, and I know that there's a website, right?
Yes.
It's called International Health Emissaries.
Correct.
And it's the www.internationalhealthemissaries.org.
Correct.
And so they can go there for
They
further
can go there.
information.
Exactly. We have
Okay.
a really great website.
Great. Now, Dr. Bayless, as I said, I go somewhere to developing country at least
Right.
once a year and do cleft lips and palates.
Correct.
And every year we bring a pediatric dentist because these...
Can I go with you?
I hope you do sometime.
I would like to.
I hope you do. I mean, this is a formal invitation in
Thank
front
you very
of
much.
thousands of listeners
I
and
will
viewers.
accept that invitation. That's how these places, that's how we end up going to these places.
Right. But the point I was going to bring up is that the children with cleft lip and cleft palate oftentimes need a pediatric dentist.
Correct.
They need pediatric orthodontia, et cetera.
Exactly,
So
just as they do here.
Right. So those problems can be fairly complex.
Very complex.
Now, in your office here, do you see children who need dental attention who've had a cleft lip or palate?
Oh yes, we do. I have quite a few patients, cleft lip and palate, and they're usually seen followed by the craniofacial team up at Stanford.
Right.
And they would make recommendations to me on which teeth they would like for me to remove, and then timing on their next surgery. And so we have a lot of those patients, and they do have some very special needs.
Okay. Now let's talk a little bit more about your trips overseas. Now, can you tell us some of the countries that your organization goes to?
Yes, years ago we started going to Mexico with a group called Los Médicos Voladores, which means the flying doctors. And then we branched out and we started a clinic down in Guatemala. It's on the Rio Dulce, which flows, the big river that flows in through the jungle and down into the Caribbean. It's an absolutely beautiful place that we go, and we actually have a clinic down there. And we go there once a year, every single year. I was just there in November, and that's what that article was about.
To Guatemala?
Yeah, to Guatemala. But in addition to Guatemala, we also go to Peru, we go to Ecuador, we also go to Cambodia. We have been to Belize, and we're trying to plan a trip back to Honduras, and also to Nicaragua.
Now, Dr. Bayless, is that organization International Health Emissaries? Now, is that based in Monterey, or there's
It
a chap?
is.
Oh, it's
It
based
is, yeah.
here in Monterey.
It's based here in Monterey. We made our own private nonprofit to do this because we had worked with other organizations, and we kind of wanted to do it the way that we wanted to do it. So my partner, who's now retired, but Dr. Jack Fea, and I got together, and his brother Ron Fea, and there's a lot of locals here who are involved in it. And we set up a board and set up a private nonprofit, and continued our work through our own private nonprofit.
Well, Dr. Bayless, I know this work tends to get fairly expensive. I was going to say very expensive in terms of you've got to get the team down there, and you take equipment and supplies, et cetera.
Correct.
Now, does your organization take donations? Do you raise your own funds?
We raise funds. We do a mailer every year, and people donate us money, and the money pretty much goes towards supplies. We pay our own way on these trips, our own flight and our own lodging, and we take care of all of our own personal expenses. But the money that we take in, which makes us a very efficient private nonprofit, we have an extremely low overhead because almost all the money that is donated to us is spent on lidocaine, which is local anesthetic, gauze. It's also spent on all the supplies that we need in the dental office, the anesthetic, the amalgam, the sealants, everything that we take. So we're very efficient. But in addition to taking down those supplies, we all carry a huge red duffel bag full of clothes and toys. Every single one of us has our personal gear plus the big red bag. And those clothes and toys are, we have clothing drives like at River School in Carmel and at All Saints Day School. And All Saints Day School is a fundraiser and raises money for us also and gives us money to buy supplies. And so we're pretty low-key. We don't have a giant fundraising organization, but we raise enough money to buy new handpieces when they break. And we have portable dental equipment that we take with us also, portable compressors, and so we can run a dental handpiece. But when we get there, we usually take a table like this that's in a school, and we lay the kids down on the table, and we go to work. We don't have expensive dental chairs or those kind of things where we go usually. Particularly in Cambodia, we get taken out into the countryside into a little school, and we shove all the desks together, and we say, where are we going to put them? And we line them all up, and we have 4 or 5 tables. We'll have maybe 4 or 5 dentists on a trip and about 10 to 12 volunteers. And the volunteers consist of family and friends. I take my boys with me, and my wife goes. They've been going for years. And everybody can do something. They can sterilize instruments. They can be a dental assistant. They can hold a flashlight. They can hand out clothes and toys at the end, and everybody gets involved. And in that way, everybody is very busy and feel like they're contributing to the entire process. And it's pretty exhilarating. It's the only time a dentist is ever a rock star.
Dr. Bayless, you know, I think it's terrific that you donate your time when you work so hard for all those kids all over the world. Now, I do want to give out your website one more time, and I'm going to ask you for your phone number, okay, in case people have questions about pediatric dentistry or their kids. So it's called International Health Emissaries, and it's internationalhealthemissaries.org.
Correct.
And now, what about your office phone number? Can we give that out in case
Yes.
people have questions about pediatric dentistry?
Correct. My office phone number is 375-9232.
Dr. Mark Bayless, pediatric dentist, right here in Monterey.
Correct.
375-9232, and you're associated with the International Health Emissaries, and you guys give away all kinds of pediatric dentistry care to children in developing countries. Congratulations, and thanks for doing that work. And you know, maybe we can go on a trip together sometime.
I would love to.
I'm going to go in a month to do cleft lips and palates in South America, and another year, maybe we could get the team together.
I've always wanted to work with a team that's doing cleft lip and palate repair. I think that would be really exhilarating.
Well, we'll arrange that.
Okay, let's do
You never know what
it.
can happen from this. Dr. Bayless, thanks
Okay.
for coming on the program. I hope you come again.
Thank you very much. Thanks for having me.
Our pleasure. I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. Thanks very much for joining us, and please come back again.